This condition, technically referred to as ankylosis, is when the tooth, in this case a baby tooth, becomes stuck in the bone and does not continue its normal upward journey into the mouth as the other teeth do. You can see in the X-ray that the middle tooth is not as high up as the two teeth on either side. If this situation is left untreated, the other teeth in the mouth will continue to move upwards. But the ankylosed tooth will stay below and eventually will be buried in the gums. This leads to abnormal bone formation in the jaw. In addition, the adult or permanent tooth underneath the baby tooth has a tendency not to be pointed in a completely upward direction, but is oriented to one side or the other. It can also be seen in this X-ray that the adult tooth is pointed to the side of the mouth and not directly upwards. It is a frequent occurrence to have more than one ankylosed baby tooth in the mouth at the same time, and usually it is the tooth on the opposite side of the mouth, as seen in this X-ray. This photo is of the same tooth seen in the first X-ray and clearly shows the tooth below the level of the other teeth. Notice how close the gums are to the top surface of the tooth as compared to the tooth behind it. Treatment is to remove the teeth that are ankylosed, as seen in this photo. The reason removal is necessary is to allow for normal bone growth of the jaw and to aid in allowing the permanent tooth to upright itself and come into the mouth in a more correct position. This photo was taken immediately after the removal of the ankylosed tooth. But removal of the tooth is not all of the treatment needed. If nothing else is done after the removal of the tooth behind the one removed will move forward and eventually take the place of the tooth that was removed. This creates orthodontic problems such as crowding. Remember, there is still a permanent tooth underneath in the bone below the baby tooth that was removed, and if the tooth behind the one that was removed moves forward, there will not be room for the permanent tooth to come in. To prevent the tooth behind the tooth removed from moving forward, a device such as this, called a space maintainer, is placed in the mouth and glued to the back of the teeth. This photo shows how the space maintainer works to prevent the back teeth from moving forward. There is a small wire attached to the bands around the back teeth that is located inside all of the lower teeth. The wire rests against the inside of the lower teeth and thus prevents the back teeth from moving forward. A space maintainer must be custom made for each patient. This is done by taking an impression or mold of the teeth. The impression material is mixed in a bowl with water and placed into a tray. The tray with the impression material inside is placed into the mouth of the patient. The impression material hardens in about 1 to 2 minutes. This is then used to custom make each space maintainer for the individual patient. The space maintainer is placed into the mouth with the bands glued around the back teeth. One can see the space maintainer in the mouth and how it keeps both back molars from moving forward. The procedure is carried out using local anesthesia or numbing medicine with nitrous oxide, sometimes called laughing gas. The patient is very comfortable. She is also very happy because the procedure may have prevented the need for orthodontic treatment or braces later.